Hello friends, let's come to an important topic today and welcome all of you to my channel. So in this video we will talk about approach to altered consciousness or approach to altered mental status. So the first thing that should come in your mind that altered mental status is actually not a disease, it is actually a symptom. It is actually a symptom, it's not a disease. The second thing that should come in your mind is actually the patient of the altered mental status comes usually in the emergency department. So this problem, we can say the problem is actually the acute problem. The problem is actually the acute problem. The first thing that what is altered mental status? So altered mental status means the patient will come to you with certain symptoms, like the patient will be confused. So the patient is confused, and it means that the confusion is actually related to the consciousness. If the patient is having the confusion, it means there is somehow problem in the consciousness. And if there is somehow problem in the consciousness is totally related to the higher cerebral function. The consciousness is totally related to the higher cerebral function. And if the consciousness is altered, or if the patient is having the confusion, it simply tell you that there is some kind of problem in the higher cerebral function. And the higher cerebral function also include the memory, the attention, the awareness. So the patient of the altered consciousness or altered mental status will also come to you with the problem in the memory, that he is not having the good memory, he is not attentive, and the patient will have problem in the awareness, that he is not cooperative, he is not aware about what is happening going around him or her, and he may not give you proper history as the patient is not aware of his surroundings. So there will be problem in the higher cerebral function. And yes, the patient of the approach to the patient of the altered mental status will come within minutes to hours to days, but maximum they will come within hours. And so we can say that the problem is acute. And there is another term that is known as delirium. There is another term that is known as delirium, and one should know the difference between the altered mental status and the delirium. See, actually the delirium is actually the slow process. It means if any person is having the altered mental status, but that is not an acute process. I mean that the delirium is such a thing that there will be the waxing and waning of the altered mental status, that the person will have some good days in which his consciousness is okay, and some bad days in which he will having the altered mental status, or there will be problem in the consciousness. So there will be waxing and there will be waning. It means there will be good days and there will be bad days in the delirium, and the process will be very slow. It means that the person will not directly develop the confusion or memory or attention or the lack of awareness. There will be very mild problem in the initial days, and the problem will actually increase with time. So as the time passes, the problem severity will get increased. So that's how that process occur in delirium. So that is delirium. But altered mental status is an acute change, and we will talk about what are the causes of altered mental status. But at this point of time, I will only let you know that delirium is a different entity from the altered mental status. Delirium is a slow process, while the altered mental status will be a fast or rapid process relatively, and there will be waxing and waning of the altered mental status. But in the altered mental status, there is no waxing and waning. The person will have problem, and once you won't treat that problem, then the problem will not go away. But in the delirium, there will be some good days when the problem will be removed, and so again the problem will come, and the process is very slow. So this is actually the delirium. So I think you know now the term what is mental status and what is the difference between the delirium and altered mental status. So I have already said you that altered mental status is basically a symptom, not a disease. That's why there are different conditions where the altered mental status will actually be seen. So there are different ways to memorize it, but I will memorize in this way. So in this figure, on going from top to the bottom, let's start from the brain. So there are some causes related to brain, there are some causes related to the food habits, there are causes related to the thyroid, there are causes related to the lungs, there are causes related to the GI gastrointestinal system, some cause related to the hepatobiliary system, some cause related to the renal system, some cause so there are some metabolic cause also. So let's start. So in the head, in the brain area, there can be the altered mental status due to the tumor, any tumor in the brain, or due to the stroke, that is also known as cerebrovascular accident, or the subdural hemorrhage, or the subarachnoid hemorrhage, or the intracranial hemorrhage, or the seizures. So any of these conditions like the tumor, stroke, subdural hemorrhage, subarachnoid hemorrhage, intracranial hemorrhage, seizures can lead to the altered mental status. Similarly, there are some infective conditions that can affect the brain, like the meningitis, encephalitis, and cerebral abscess. So the meningitis, encephalitis, and the cerebral abscess, these three conditions can lead to the altered mental status. Now there are some causes related to the food habits. So if the person is taking some sorts of the medicine or the alcohol, so the alcohol and medication can also lead to the altered mental status. And there are some causes related to the thyroid gland. So the hyperthyroidism, so hypo, either that is hypothyroidism or the hyperthyroidism, both can cause actually the altered mental status. And there are some cause related to the lungs. So in the lungs, if any cause that is causing the hypoxia or retention of the carbon dioxide in the lungs, then that may lead to the altered mental status. So what are the causes that can lead to the hypoxia or retention in the CO2? So the cause will be like the COPD, the asthma. So the COPD, asthma, and other chronic bronchitis. So these all can lead to the, or in the emphysema. So the emphysema, the COPD, the asthma can also lead to the altered mental status, as they will basically cause the hypoxia and the retention of CO2 in the lungs. And there are some causes that is related to the infection. So infective condition of the lung is pneumonia. So pneumonia also can lead to the same problem, that is altered mental status. And the cause related to the GI system, that is a hypoglycemia or the diabetic ketoacidosis. So diabetic ketoacidosis in the diabetes mellitus patient, in the basically in type 1 and type 2 also, or the hypoglycemia also can lead to the altered mental status. And there are some cause related to the liver, that is hepatic encephalopathy, or after the cirrhosis in the liver cirrhosis patient. So in the patients of the liver cirrhosis, again the patient of the liver cirrhosis or the chronic liver disease will develop the hepatic encephalopathy. And after developing the hepatic encephalopathy, there can be the altered mental status. And there are some causes related to the renal system, that is a urinary tract infection or the pyelonephritis or the sepsis or the septic shock. These all also can lead to the, somehow in the later stages, can lead to the altered mental status. And yes, there are some metabolic causes. Those cannot be seen in the figure. So the metabolic causes and the metabolic disorders are hyponatremia, meaning that sodium level in the blood is decreased, or the hypernatremia, means the sodium level in the blood is increased, or the hypocalcaemia, means the blood level of the calcium is decreased, or there can be the hypercalcaemia, that is the blood level of the calcium is increased. And there are some other sorts of metabolic disease also that can also cause the altered mental status. And yes, there are some psychiatric disorders, psychiatric disease. So this psychiatric disease, some psychiatric disease also cause the altered mental status. Some, not most of the psychiatric disease cause altered mental status, but yes, that is a different part. So today we are basically focusing apart from the psychiatric disorders. So these are the problems basically. So we will look at these problems. So how can we, when a patient of the altered mental status will come, then how can we go to the at least one diagnosis from from this much differential. So there are so many differentials, but also we have to reach to a single diagnosis. So how can we reach to that diagnosis? So today we will study this thing actually. So when a patient with a altered mental status will come to you at the emergency department, so always in the any emergency condition we will always go for the ABC, that is airway, breathing, circulation. So see whether the airway is correct or not. You will auscultate the lung sounds, that the lung sounds are present or not. If the patient, if the lung sounds like the sound of the incoming air or the outgoing exhalation or inspiration is okay, then the airway is okay. And see whether there is a chest movement or not. So if there is a chest movement, it means the patient is breathing, so that is also okay. And for the circulation, check the blood pressures, check the pulse. So you have to check the blood pressure, the pulse. So you can check these things. And now you should see when a patient with altered mental status, especially in this patient, you should see two things, that is the oxygen saturation level from the pulse oximeter or the ventilation, or from the blood glucose. So you have to look for the blood glucose or the oxygen saturation level from the pulse oximeter. From pulse oximeter you can see the oxygen saturation level and the blood glucose immediately. If these are not okay, then you have to just correct it. So if okay, then no problem. If not, if these are altered, then immediately correct them. So how can you correct them? So if the blood glucose level is decreased, you can give them the dextrose normal saline. And if the saturation is decreasing, then you can give the oxygen from the face mask. So from the face mask you can give the oxygen, and if there is a decrease in blood glucose, you can give the dextrose normal saline. So immediately once the patient comes, you should do this thing. So the patient with the altered mental status can be of 2 or 3 types. That the patient can come with a coma. It means there is a not even the single perception is present. It means the patient is totally comatose. So I think that you must have known the meaning of comatose. There is a total loss of consciousness. So there is a total loss of consciousness. It means the consciousness is altered in that level that there is a total loss of consciousness. So the person is totally out of consciousness. So that is comatose. And in this type of patient, we cannot take the history from the patient themselves, that the patient will not follow any commands. Now the history should be taken from the family. So history should be taken from the family members. And another thing, there we have to do the all the lab test, all the imaging test. Especially the imaging means there can be the need of the CT scan or the MRI or any kind of ultrasonography. So or the X-rays. So there can be need of the imaging test, the lab test. The lab test means the test that is run in the blood or the urine. And so these are the things that should be done in the patient. If the patient is the comatose, it means the patient will not tell us anything. All the things will be now the history should be taken from the family and these tests should be done. Yes, but if the patient is actually the following orders, he is having altered mental status, but the patient is following our instruction. So in this case, if the patient is also following the instruction, the history of the altered mental status, suppose if any patient is telling us that I am having confusion, I am having the loss of memory, or I am having the attention deficit. So in that condition, but the patient is talking to you, following instruction, then the history should be taken. Both from the patient and from the family. So the history should be taken from the patient and both the family. And yes, also there also needed the lab test, and somehow the imaging test also are needed. tests are needed. And yes, one more thing, that you will also do the neurological examination. So the neurological examination will be done by yourself in this patient as they are following the instruction. So the neurological examination can be done.